In 1987, I completed my nurse training at Ballarat Base Hospital. I was one of the last hospital trained groups there. I was keen to do further study pretty much out of my initial training. I did my ICU and critical care nursing course at Ballarat Base in 1991. And then later on I left nursing and I came back into a management position at Williamstown Hospital, part of Western Health. And then I had a baby at that time, so as my return to work was a bit difficult to negotiate, I went into working for a GP, which was a totally new area for me. And at that time I realised my hospital work hadn't prepared me for work in the general practice, and it was clear to me that I needed to do some more study. The main obstacle is time. My daughter's now nearly 7, but she was 3 when I got the scholarship to do the Graduate Certificate of Diabetes Management from the Australian Practice Nurse Association. So I really thought I had to take that opportunity while I had it, because it was a substantial financial amount. I was still working at Western Health. They were quite supportive if I needed time off to go to uni. Universities are very supportive when you do study as a mature age student. So I'm 45 and I was never went to uni initially. So it's an ageing workforce. Still probably most of the nurses haven't been to uni. So the help is there and the understanding is there. People will empathise with your situation. Especially I've found nursing faculties, they really understand if you ring up and say your kid was sick or you were called into work. Or yeah, I think the later you wait to do study, the more you have to say, and you've got a question. It's much easier to do the study when you've got a real need to do it, I think. I went on my own sort of undertaking and I did the nurse immuniser unit at La Trobe. And once again I had great support, financial support from the division. They paid 80% of that. And I won a scholarship from APNA to do the Graduate Certificate of Diabetes Education at Deakin. And the diabetes education has been massively helpful, because I do the Enhanced Primary Care Program care plans. So I've got a very clear idea of the annual cycle of care that's required for those patients, and I can help the doctor and help the patients. Well-educated practice nurse is a really valuable member of the community team. The patients can't see the difference. I feel really confident that I can have a voice in the care of the patients rather than just opinion. I'm happy with being a working mother and a studying mother. I'm really happy to provide that role model for my girls. I think it's good.